Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel talking about plastic surgery. I'm here with my wife, Betsy Ronel.
We just had Eden Kark on, Dr. Eden Kark, who's going to be joining Daniel's practice the beginning of May this year. And what a find.
He's a doctor of Oriental medicine, an acupuncturist, a massage therapist, and a Chinese herbalist.
My God, I cannot wait to make use of Dr. Kark.
Yeah.
And he's handsome, and he has that beautiful English accent and that soft voice, too, to go along with it, girls and guys. So, you'll be getting your money's worth. Anyway, come on down and make an appointment with him because, I mean, you can use him in so many ways. Patients can use him in so many ways.
He's a therapist.
Right. I mean, you don't even have to go for surgery. He's an independent practitioner.
Right.
You don't even have to deal with Dr. Ronel if you don't like Dr. Ronel.
Right.
You can just go to Dr. Kark. Anyway, all right. Eden's awesome, so please make appointments with him. We're trying to support him and make him a household name in little old Santa Fe. Now, the big Dr. Ronel, as I mentioned, actually not in this show, is featured in the current issue of New Beauty magazine with Courtney Cox on the cover. And he's featured in it in his own profile, but also he's quoted many times on celebrity injectables. And the body part that they're focusing on is your set of lips on your face. So, doctor, let's talk about issues that women and men have with their lips.
The biggest issue is aging. You know, there's two sets of patients. There's the older patient who has aging lips. They're thinner, they've lost their volume. It really makes them look older. Then there's the younger set of patients who have the lips of their youth, but they're just smaller than they would like it. For whatever reason, they just want bigger lips.
What about the people in their late 30s, early 40s who are beginning, with expression only, to see the future lines of their 60s?
Right.
That's a third set of patients,
third
dude.
set,
Don't forget us.
Yeah, when that moves it beyond the red part of the lips, but to the area of the lip above the vermilion border, the area between the lip and the nose, where a lot of people see wrinkles. And you don't have to be a smoker to see wrinkles there.
No.
It's just loss of volume, sun damage, not the best healthy living habits can cause
Too much partying.
these wrinkles there. And so the treatment can be categorized into a couple different ways. One is to restore volume if you've lost it, or to add volume, and that's usually done with a filler. And there are a couple different fillers on the market. There are people who are tired of getting fillers because they eventually wear away, and you can do permanent lip augmentation with implants. And there are saline and silicone implants for lips just like there are for breasts. We'll talk about that. And finally, there are people who really have a long upper lip. For those of you watching me on YouTube, this is called the philtrum, P-H-I-L-T-R-U-M.
Like that little depression right under the
philtrum is actually the column, the two little columns, and the area in between is a depression, and it leads to what's called the Cupid's bow. Every part of the lip has a anatomical name, which is important because when people are dealing with lips, you really have to understand the three-dimensional anatomy of a lip, or else you're just sort of shooting a filler in there blindly. So people who have a very long upper lip can have a resection, a subnasal resection. I just did one yesterday, which is just a removal of some of the skin under the nose, and it lifts the lip up and it turns it outwards.
Does it make you look like a bunny?
No, if it's
your two front teeth sticking out.
If it's overdone. But interesting that you mention that, because one of the aesthetic ideals is how much incisor show there should be.
That's his favorite phrase. He even says it in the magazine.
Okay.
I think it's ridiculous.
Yeah. You know, how much, I mean, look, who is this?
I know, Dr.
Jennifer
Garner.
Okay, when you look at Jennifer Garner's
it's a
picture,
great picture of her.
In relaxation, she's got some incisor show, so you can see her incisors, her front teeth.
When her mouth is open.
Right.
Okay.
And so, and even at rest, there can be 1 or 2 millimeters of incisor show. And so that's what people are going for when they have a subnasal resection.
Okay.
You just turn the page and we're looking at Nicole Kidman. She's got plump lips and a very nice Cupid's bow.
She didn't used to. She had very thin lips when she was young.
And that's really easily done with filler. And Juvederm, Restylane, the hyaluronic acid fillers are great for this because they're clear and they're smooth and they're silky. Those people who really know how to inject Artefill can use Artefill there, and that's also a fantastic filler because it lasts so long.
All right, I have it in my lips. It's great.
Yeah,
It doesn't hurt as much as the others.
And there are, every few months, there's a new filler that comes out, and now the makers of Juvederm and Restylane have come out with a product that has lidocaine built into it, so it doesn't hurt as much.
All right. Right. All right, so wait, so here, I'm just going to go back to the magazine for a second. It's saying redefine the border of your lips. There's a lot of women who don't really have that definitive line between their upper lip skin and their pink lip.
That's called the white roll, R-O-L-L, and the white roll has to be really defined in order to hold lipstick and to make a nice demarcation between the red, the vermilion of the lip, and the tan color of the skin. And so the way to augment the white roll is with a filler, is to do an injection there. The surgical techniques for this are not good. So it's hard to I take off a lot of skin cancers, because that's one of the #1 places for squamous cell skin cancer.
Right.
And having to reconstruct the white roll is not easy. You can see from across the room a 2 mm discrepancy in the white roll, and so it's very.
A surgeon or an average Joe?
Any person who looks across the room, when you see somebody with a 2 mm discrepancy on their lip, you'll notice it. And so when somebody is reconstructing or augmenting the white roll, it has to be done very precisely.
And they're saying that just aside from skin cancer removal, what causes this in some people? Obviously it's genetics, but it also says here sun damage and smoking.
Right.
And so they say one way to prevent it, avoid collagen damagers.
Right. So
so it says stay out of the sun and limit smoking.
stay out of the sun, limit
It's very
smoking.
hard here. Stay out of the sun.
Right, well, or at least wear sunblock. And many people put sunblock on their skin, but they forget to put it on their lips, and there are great lipsticks with sunblock in them now, and those are very important. Eating healthily, antioxidants, those are all things that will help prevent collagen breakdown.
A worry that I have, which is why I never forget to put sunscreen on my lips, I'd actually put it, it's so bad.
Right.
I'll put it on my lips before I put it on my face sometimes. It's so wrong, but that's the truth. Because, and here's a little snippet on it in the article, freckles. I don't want to get freckles on my lips. Can a laser take those off? I mean, what do you do if you have freckles?
That's very difficult.
On your lips?
No, it's very
From
difficult.
the sun?
It's hard.
Really?
Because lasers are very painful and
Yeah.
it can cause burning of the lips. There are some very mild lasers. If anybody could do it, Mary Nirvana in my office could, but I don't think she'd try that. There are some topical solutions that also are not great for lips because they get mixed up with the saliva. But no, the best thing to do is to avoid freckles. Once you have them on your lips, it's very hard to get rid of them. Yeah.
I have one.
You just have to watch it to make sure it doesn't become.
All right, so quickly, I know,
Right.
don't worry. Just
Yes,
quickly,
we're gonna wrap
recap lips.
Recap
What
lips.
are some of the reasons to treat lips with injectables?
Thin lips, wrinkles above the lip. If you just want a bigger lip, injectables are the way to go. If people want to have more incisor show to turn the lip upwards, you can also have a surgery. It's an office procedure, the subnasal resection. And for those people who are tired of getting injections, get the fillers. There's great fillers out there. The Permalip, which is like a gummy worm, the silicone is excellent.
Can you put that in with injectables on the upper lip skin part?
You can.
For
do
older
that all
women?
the time. Do that all the time.
All right,
we've got to wrap things up.
Shoving us off the air. Okay.
Thanks very much for listening to Talk 1260 KTRC, the Humanity Behind the Vanity. It's Dr. Daniel Ronel. We're going to wrap things up. Thanks.